Hi, everybody. Welcome to Black Health 365. I'm Kenya Brown. And as we head into the holidays, many of us are thinking about family meals and celebrations. But for some in our community, putting food on the table remains a daily challenge. Food insecurity isn't just about hunger, it's about not having reliable access to affordable, nutritious food that supports good health. That's why University Hospitals is taking a holistic approach to addressing food insecurity through its Food for Life markets. Now open in several Northeast Ohio communities, nutrition and access to healthy foods play a major role in managing chronic and severe health conditions. Joining us today is Celina Cunanan from University Hospitals, who will share more about the health system's food security programs that support the Black community, including access to healthy foods, nutrition education, and cooking demonstrations. How are you?
Grateful to be here, Kenya. Thank you so much for having me.
Absolutely. So let's kick it off. Let's talk about food insecurity. What leads to it, and what are the effects on health and well being?
Yeah, those are great questions. Food insecurity really means that people don't have access to food that they need to basically live and survive.
Yeah.
Why does this happen? We know that, access to food is not always a given in communities. Maybe there's no access to grocery stores in their community, what we call food deserts, or maybe it's limited income, unemployment, or just as we've seen over and over again over the last year or so, high cost of food, being able to afford that.
Yeah.
And then again, you have problems with our communities in which there is inequality or lack of ability for transportation or even education about why healthy food is important, and drives your overall health outcomes, no matter what they are. So I think that is, those are things that happen or causes of food insecurity. So what does that mean in terms of your health? We know that if you don't have access to the proper foods and nutrition, that they can contribute to chronic conditions such as diabetes, hypertension, heart disease, obesity, weakened immune function. If you're thinking about pregnant women, which is my specialty area as a certified nurse midwife, low birth weight, poor nutrition on pregnancy, the depletions on mom's health afterwards because they're not getting the right things they need during pregnancy. And then there's a lot of research and indications that show they're looking right now about how nutrition plays and can play a huge impact on mental and social well-being, increased stress, anxiety, depression, even social isolation. We know that children without proper nutrition or the right kinds of foods can experience developmental delays, learning difficulties, and behavioral challenges. Nutrition is the core of what drives most health outcomes. And so it is a tragedy when we look here in the United States, other parts of the world, in our own backyards here in these communities in Northeast Ohio, that people don't have access to food. And so that is one of the ways in which we're trying as a healthcare system to say, I can talk to a patient all day long and tell them, you need to eat this, you need to eat that, you need to more fruits and vegetables. But it's a much different question to even start that conversation saying, do you have access to food? And that is it's a core basic that we're sometimes missing in healthcare. And that's why at University Hospitals, we knew many years ago that this was something that we really wanted to focus on and try and address for the communities that we service.
Absolutely, because when you think about you go to the doctor and you want something to fall out of the sky, you want some miraculous cure, but sometimes the answer is really simple, and food is one of those things.
Yes, absolutely. I think it starts with what you put in your body. And, even when you talk about recovery from surgery or you look at cancer, what can drive cancer? How do people develop cancer? Sometimes it's what they put in their bodies, right? Alcohol, right? Tied to cancer risks.
Don't say it.
I know. Everything in moderation, right? But those are things that we need to consider. And, I think the processed foods that are out there, right?
Yes.
If all we have is convenience stores in neighborhoods that can't handle or don't have the capacity to have fresh produce or lean meats, those are the things that that can drive poor health outcomes when you're looking at processed foods. We don't really know what's in them. If you cannot pronounce the things on the label, it's probably best to stay away from them.
Yes, I agree. My husband is a stickler for the food that we bring in the house. So if you have someone who's trying to do good in the house and bringing some good things in the house, don't give them a hard time. Don't bring that big pack of Oreos and all that stuff into the house. Help them out. Now, University Hospitals has established the Food for Life program to address food insecurity. How does this program differ from traditional food pantries?
Yeah, I'm so proud of this program. We started this first market back in 2018 when we opened our first Food for Life market at the Otis Moss Junior Health Center, which is a collaboration with Olivet Baptist Church in the Fairfax neighborhood. And since then, we've grown to 5 locations across our footprint in Northeast Ohio. We have 3 here in Cuyahoga County, 1 in Conneaut, and 1 in Portage. So what is this Food for Life market? So I like to talk about 2 different things. We've talked about food insecurity. I also like to talk about food as medicine as a concept. And that's kind of what we've already been talking about, Kenya, right? About the
Yes.
food that you put in your body, how that it can affect your health, how that it can improve your health if you switch to the right things. And so I like to think of our program as not only a food insecurity program, it is a food as medicine program. Because when people are hungry, if they're food insecure, we give them food, maybe without any consideration for their current health conditions or status, right? Because when you're hungry, you're going to eat whatever's in front of you, which you should,
Everything.
right? Yeah,
Yes.
absolutely. And what we're trying to do is identify people who are food insecure, but also give them the right things that are tailored towards their needs and specific health conditions. So how does the program work? So as a certified nurse midwife, if I'm seeing a patient, a woman who is coming in and they answer yes to one of our food insecurity questions, I can put a referral in our electronic medical record to our Food for Life market. Then one of our schedulers will call them and say, we see that your provider has put in a referral to the Food for Life market. We have 5 locations. Which one would you like to go to? So they'll schedule them an appointment, and that appointment is actually with a registered dietitian. So our patients who get referred into this market get a one-on-one counseling visit with a registered dietitian who actually opens up their medical record, takes a look, and says, it looks like your midwife here, your provider, says that you're at greater risk for diabetes this pregnancy, or she wants you to make sure that you're not gaining too much weight in the pregnancy. And then they do a whole intake with them around what are the things that you eat? How many people are in your household? We follow the same guidelines as the Greater Cleveland Food Bank because they're our partner in this space in providing this type of work. They supply all of the food for our markets. We're really proud to make sure that to partner with them. And in that intake visit with a dietitian, they actually do that intake. They talk about the needs of the family, how many people do you have in your household, and then they'll go shopping with that individual in our market. So our markets are stocked with in-season fresh fruits, vegetables, as well as lean meats, dairy, shelf-stable items, low sodium content, things that aren't packed in syrup. We try and make sure that we have healthy options for people. And it's also an opportunity to kind of introduce them to new things, and then teach them how to prepare these foods. So our dietitians will say, hey, we have butternut squash that's in season right now. And maybe somebody's like, I don't know what that is. I don't even know what to do with it, right?
Right.
So we try and make sure that we're educating patients. Like, these are the nutrients you can get out of butternut squash. This is why it's great. Here's some great ways to prepare it. We give them recipes. We actually have cooking demonstrations too that we can give them access to at our Glenville market, which is in our Glenville Wellness Center in the Davis apartment homes. We actually have a teaching kitchen, a demonstration kitchen, in which we'll bring in community chefs and our own Sodexo chefs to provide teaching opportunities with things that are in season at the market. And these are very well attended. People love these. We record them. We make them available for people because we know it's not just about the access to food. It's about the knowledge and the empowerment and the education that people need to feel confident to say, I'm going to open up this butternut squash. I know how to cut it. I'm going to roast it. All these things. And so that's where we think we can really have an influence in a positive way to ensure that people are getting access and education about healthy nutrition. It's not just for the patient. We give patients, a patient who comes in, if she says, I have 4 family members in my household, including myself, we'll give them food for up to a family of 4 for a week. And they can come back every month for 6 months based on one referral. The only thing that at 6 months, if they still answer yes to one of our food insecurity questions, that they have to go back to their provider to get that referral renewed. And so we just want to make sure that there's a connection with healthcare, that you're seeing your provider regularly, and then that provider is making that assessment and you're getting treated for the other conditions that you have. And so far, we've seen a lot of really good outcomes from people anecdotally and in some of the research that we're seeing.
I'm truly blown away. I'm not easily blown away, but this is truly a holistic approach to your patient's care and such an important thing. I mean, all the things you mentioned, please make sure you share this video because this is something that not only you can use, this is something that your family, your friends can use because I want to sign up for the program right now. This is amazing. Like, I love all of this. So, what type of health impacts are we seeing in patients who
Yeah.
have access to the program?
I think one of the very unique things about our program is that we were very focused when we started it to really look at, do programs like this, like we know that healthcare systems have food distribution programs, but ours took a very unique approach in staffing in with dietitian and having one-on-one counseling visits. And the great thing about that is our dietitians are incredible and they form such great long-lasting relationships with our patients. And so that person can go back to the same market and see the same dietitian and they can say, hey, I gave you that butternut squash last month. What did your family think about it? And they're like, oh my gosh, we loved it, right? Like the kids loved it. I made it into a soup. That's great. Let's get you another one. And let's look at this, what we have. We have an acorn squash now. Let's try this, So I think that relationship that we see is really, really important. And looking at, it's one of the areas that we really want to look at closely is that dietitian relationship and the influence that they have on people's outcomes and their behaviors.
Yes.
But what we're seeing overall in terms of the healthcare, the entire market, is that we looked at a total of over 2,200 people that were referred to our markets between April of 2020 and September of 2023. And in addition, because we have access to their medical records and their existing patients, we looked at their demographics, clinical characteristics, and cardiometabolic measures like blood pressure, weight, body mass index, and hemoglobin A1C, which is a measure of diabetes control. We analyzed this from the electronic health record and made the conclusion that we saw that people who were referred to the market and utilized the market, about 61% of them attended the market. We know that program attendance was associated with favorable changes in diastolic blood pressure as well as BMI after 3 years from baseline. So we're really incredibly proud of that work to know that we are having a positive influence on people's health outcomes with unique models such as this. This study was recently published in March of this year in the American Journal of Population Health, Equity, and Outcomes. And we're really proud of that work to be able to kind of evaluate the program and the importance of programs like this.
So important. I mean, it really took me years to figure out how to cook certain things, what things were good for me, what things weren't. And you guys are offering this to your patients and making sure they have access, making sure they know how to prepare it. I don't know what else you could actually ask for. Health is wealth, and your food is definitely medicine. So we thank you so much, Celina Cunanan, for being here with us today and sharing this important information with our audience about the Food for Life program and resources available. You can call 216 384 9368, to schedule an appointment with a primary care provider. And to learn more about our Black Health 365 program, visit WZAKCleveland.com. Thank you so much.
Thank you.